Mr. Chairman, when patients come into the emergency rooms with a substance use disorder, hospitals offer treatment or referrals to other providers, but the demand for these services far exceed availability. Treatment is particularly scarce in rural communities, despite having an average overdose death rate that is 45% higher than metropolitan areas. In March, the Center for Disease Control reported that emergency room visits for opioid overdoses had risen 30% since July of 2016. This is why I joined with Congressman Doyle to introduce this bipartisan Preventing Overdoses While in the Emergency Room Act, also known as the POWER Act. This legislation will provide competitive grants to emergency rooms, especially those in high overdose areas and in rural areas, to establish procedures for providing medication-assisted treatment in the ER and engage in what might be known as a warm handoff of patients to qualified treatment providers, to hire coaches, counselors, and social workers and other professionals to treat the patient's substance abuse disorder there beginning in the emergency room, and establish an integrated care model for implementation in other emergency rooms across America. This bill would ensure that overdose patients receive the treatment they need in the emergency room and giving them a better shot at recovery. This legislation is supported by the Addiction Policy Forum, the National Council of Alcoholism and Drug Dependence, the National Rural Health Association, and the American College of American Physicians. I urge my colleagues to support this legislation and ask unanimous consent to enter letters of support in the record.
Without objection. Does the gentleman yield back? The gentleman yields back the balance of his time. Chair recognizes the gentleman from California.
Mr. Chairman.
Okay. Did you have an amendment?
No, I'm a co-sponsor.